As we know, that diabetes is very related to circulation and also nerve issues. And we talk about neuropathy, we talk about peripheral neuropathy for the most part with diabetes. There are other neuropathies, but the most part is peripheral or on the periphery, like your fingers and your feet. I ask people, do you have any numbness or tingling of your fingers and feet? Now, we try to teach people early on how to take care of their feet. Not that they're having problems now, but they know how to prevent problems. A lot of people are afraid that, oh my gosh, I've got diabetes, I'm going to lose my feet. And I tell them, not necessarily if you do these steps. So there are steps to do that can be not as daunting as it might seem to, but one of them is, and the most important of many of them, is looking at your feet every day. Now, some people wonder, why is that the most important? Well, because if you notice any changes, you can get on them right away. And what I have found in the years, my many years of experience, is that when you put off getting something fixed, that's when the problem is. So for example, if you've got redness on your feet, it may be that your shoes are rubbing. Okay, that's a message. Wear different shoes. It may be if you've got a cut on your foot. I need to get this looked at right away. But if you're not looking at your feet every day, and if you've lost some sensation, you may not know that a sore is there. It may get infected, and then things can have problems.
Sure.
So you mentioned, people talk about always, the first thing is you shouldn't walk barefoot if you have diabetes. And the reason is, let's go first back to this.
Sure.
A lot of times I'll ask my patients, do you ever walk barefoot at home? Or people say, I never walk barefoot except for when I'm at home. When do most accidents happen?
I guess when they're home.
When they're home. So if anything, people should wear shoes all the time, especially at home.
Mm-hmm.
But what happens, as you mentioned, the lack of sensation, when you have a peripheral neuropathy, you have a less sensation, so you might not be able to feel anything, or you may have may be able to less feel. So like if you step on a pebble, if you step on something, you may not feel it, it turns into a sore, you're not looking at it, it gets infected, you have a sore bigger than you thought, it doesn't heal, and there can be problems. So that's why it's important to look at something every day. It's why it's important to wear shoes. And when we talk about shoes, not just sandals. Think about sandals, there's no protection. So when people wear shoes, it should be a shoe that totally protects their foot, front, toes, back. I even had two patients that went to get something out of their cabinet. A can dropped on their toe. Honestly, in the end, they lost their toe. Yeah. Same thing with opening a freezer and something falling out on their feet. Feet need to be protected. Okay, that's inside and outside. Now, another thing is we don't recommend you soak your feet, but we do recommend you wash your feet every day, dry them well, especially in between your toes.
Right. And just a point about skin cream, because obviously skin cream is a very very important thing for people with diabetes, for hands and feet especially. But
especially the feet.
In terms of not going in between the toes, that's something that some people aren't familiar with.
Right. And you want to get a cream for your feet. It doesn't necessarily have to say diabetes on it. Find something that works for you, and you know by trying different creams. But to put cream on your feet, but not in between your toes. And the reason is that if you put the cream in between your toes, you can get wet in there, and it can breed infection. So you want to make sure it's dry and it can breathe, and you don't breed infection in between your toes. Something that's really helpful is to put your cream on your feet, top of your feet, bottom of your feet, and put socks on before you go to bed at night. That holds the moisture in and helps. So the reason for the cream is a lot of people have dry skin who have diabetes, even so dry that they can even get what we call fissures or cracks. Those cracks open, and they're like cuts, and then something from the outside can enter in to cause infection. So you don't want those cracks on your feet. You want them to be smooth so that your skin doesn't open and an infection gets in. Which that reminds me of pedicures. A lot of women want to get pedicures. We do not recommend people get pedicures who have diabetes. My experience has been that
what do you do at the diabetic conferences?
We teach them how to do a savvy pedicure themselves, and I was the guinea pig for that one, because seeing at spas and that, a lot of times they clip your cuticles. No one should be bringing anything sharp to your feet except a physician.
I see.
Okay, and they're clipping
cuticles,
cuticles, which is
physician or podiatrist.
Or podiatrist, and so they do that. They soak feet, which we do not recommend. Who knows what's been in that basin.
Well, so maybe no one should soak their feet in that.
I can't disagree with you. You know, when I've seen what can go on.
I'm gonna have to get in touch with my wife and let her know she can't have any more pedicures. I
But
don't
you
think she's
can't-
gonna be too happy.
But you really can do this yourself, like using an orange stick and pushing back the cuticles, using creams. Yeah, then if you want to go to the spa and have them paint your toenails, not a problem. Or you can even learn how to paint them nice yourself. Just think of the money you can save.
Yeah, well, I don't think my wife will be too happy about it, but some tips on foot care and not getting pedicures from Joy Pape.